Hello, welcome to From Care to Cure, an educational webinar series presented by the Massachusetts General Hospital Frontal Temporal Disorders Unit. My name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations for the MGH FTD unit. It is my happy role to coordinate educational opportunities for our community of persons living with a diagnosis, care partners, and healthcare professionals that can improve the understanding, care, and treatment of frontal temporal dementia, atypical Alzheimer's disease, and related conditions. The From Care to Cure educational webinar series aims to empower our families and our community members with knowledge and information presented by our expert team of staff and clinicians. Today's presentation will be given by Dr. Bonnie Wong and provide an overview of brain health and wellness. Dr. Bonnie Wong is the director of the neuropsychology program for the Frontal Temporal Disorders Unit. Dr. Wong is a board-certified neuropsychologist with over 20 years of clinical experience working with adults affected by a range of neurologic conditions. She has developed and directed programs focused on maintaining brain health, slowing cognitive decline, and training cognition through music and movement. Her primary clinical and research focuses include interventional neuropsychology, cognitive reserve, and the use of technology in assessment and cognitive training. Dr. Wong's hobbies include flamenco, both dance and castanet work, flamenco engagement programs at skilled nursing and independent living facilities, classical piano, study of partnering, and human interaction. It is now my honor to turn today's program over to Dr. Wong for the next presentation of our From Care to Cure 2021 educational series. Cognitive Resilience, a brain healthcare plan for care partners and their loved ones.
Hello, everyone. It is great to be here for another year of FTD Education Day, now expanded to FTD Education Month. I'm happy to be here to talk about a topic that is often on everyone's minds, especially when we think about conditions such as FTD and related disorders. And that topic is how we should be thinking about brain health and cognitive resilience. What should we be doing to take care of our loved ones who may be affected by a condition such as FTD, and how we can, as care partners and caregivers, do the same to maintain our own brain health so that we can be there for our loved ones in their journey. You might think that the roadmaps are a little bit different, but in fact, there's a lot of overlap and ways in which we can go about taking care of ourselves and others, and that can be done together. In a way, I think of this as being a creative process for you and your loved ones, where you know what the core ingredients are, which I'll talk about a little bit today, using some of the science and sharing with you some of the science that we've learned over the years. But the key to your recipe is really what you bring to the table, your own special touches, your own special spices, if you want to think of it that way, special ingredients to make it your own family recipe. Much of this recipe and its preparation is a bit of art that I think of as you bringing to the table, those touches, playing with it, experimenting with it, making it a recipe that is right for you and that will become your family recipe. Coming up with the right ingredients is always challenging, especially during the pandemic, as many of you have now seen. But I think that the pandemic has actually allowed us to get more creative in finding these resources, whether they be around the house or in our neighborhoods, and very much so on the internet. So let's keep that in mind as we go through the pieces of this puzzle, the ingredients today. What examples can you think of as we go through each piece of this puzzle? What examples can you come up with that would be your particular ingredient in this recipe for your brain health? So let's start off with some more basic principles. What is a healthy brain? Well, a healthy brain is one that adapts very well to the environment, and a healthy brain is essential for a healthy body and vice versa. Why? The two are connected. So when we think about how we maintain our physical health, that is also a way for us to maintain our brain health. When our brains are healthy, we can think better. And when we can think better, we can actually think about how we do things in our daily lives that will promote good physical health. And when we're physically healthy, when we have good cardiovascular health, pulmonary health, that supports our brain functioning. So it's a circle that we want to maintain as optimally as possible. So what is a healthy brain again? A healthy brain is another way to think about it as a plastic brain. What does that mean? Plasticity means really our ability to adapt to the changes in the environment, how we can actually change so that we can compensate for what the genetics in our bodies have actually laid out for our futures. Genetics does not mean destiny. We know that that might set things up in a particular way, but if our brains are healthy, we might be able to figure out those other factors that allow us to adapt and even circumvent, get around the problems that genetics may have put before us. So a healthy brain allows us to do all those things, to adapt and modify things so that we can function at our best. So let's start with some of the core ingredients. People have been studying nutrition and diet as a component that's been key to brain health. Again, when we think about nutrition, that's about physical health as much as our brain health. There's been some suggestion that certain types of diets may be good for reducing an inflammatory response in our bodies and in our brains. There's some suggestion that neurodegenerative disorders such as Alzheimer's disease may in fact be a reflection of some type of inflammatory process in the body. So people are thinking, well, maybe there's something that can be done when it comes to our nutrition and diet. Some people are also wondering whether there are certain diets that are protective. You've heard a lot about blueberries and oils that may be good for your brain. All of that is really hard to understand and make sense of. The research on it is very difficult to do, partly because everybody has individual body chemistry as well. Different microflora. People have talked about the brain-gut axis and how everybody's gut biome is a little bit different, which makes studying these things a little bit more complicated. Generally, people talk about following a heart-healthy diet, which is a Mediterranean diet. And that consists of things like fish, lean meats, lots of fruits and vegetables, and oils such as olive oil. That seems to be the general trend in this research, and seems to show some good connection with physical and brain health. And generally you'll hear doctors suggesting that you follow a Mediterranean diet. Most importantly, when you want to think about a healthy diet for you, you need to work with your primary care doctor who knows you personally and knows your physical health and profile, so that they can help you modify the diet such that it is optimal for you. So basically, the jury's still out on nutrition and diet, but it seems as though anything that's good for your body is going to be good for your brain. So try to keep that in mind. What kinds of modifications can you make in your diet right now that might be a little bit more heart healthy and maybe lead to more of that neuroprotective factor? The next component is sleep. And there are a number of reasons why sleep is an important ingredient. Number one, as we all know, if we do not get good sleep, even for one night, that impairs our ability to pay attention and stay alert the next day. Whether this is about getting through the day, having conversations, cooking a meal, navigating the environment, driving, we all need to be alert and able to pay attention and ready to be able to address the demands of all of those activities. And to be able to adapt in the moment. So sleep is important in the short term for attention and alertness. Sleep is also important for forming new memories. It turns out that certain stages of sleep is when we actually are consolidating the information we learned and saw and gathered over the course of the day. That's also a time when certain connections are being pruned and cut away, those connections that may not be as important anymore, just to improve the brain's efficiency. And that's also a time when the brain may be making these new connections between the new memories and the old. Sleep is also important for physical health. Why is that? It turns out that sleep quality and sleep patterns may actually be related to one's metabolism. When people have poor sleep, they may end up having problems metabolically. which can result in a whole host of problems. When people don't sleep well because of sleep disordered breathing, for some of you may have heard of conditions such as sleep apnea. When sleep apnea is present, what happens is your brain may be deprived of oxygen. It puts more stress on the system and can lead to things like hypertension and even stroke. So you want to make sure if you have a sleep condition like that, which can be treated, that gets treated so that you can maintain that level of physical health for your body and your brain. There's also suggestion that sleep is important for housekeeping. What do I mean by housekeeping? There's a very active body of research within the last 5 to 10 years or so, looking at what happens during sleep and certain phases of sleep. And it turns out that during certain phases of deep sleep is when the brain may be trying to shed some of those harmful proteins that are accumulating. Proteins that some of you probably have heard of, beta amyloid. Now, there have been studies that looked at the connection between the poor quality of sleep and how much beta amyloid may accumulate. It's unclear what direction that relationship goes, but there seems to be an association in those individuals who show more beta amyloid accumulation over time and the quality of their sleep. Certainly in mouse models, what they found that if you can improve sleep in the mouse models, at least you can actually slow down or even halt the progression of the accumulation of beta amyloid. So there are a lot of studies out there that suggest that there's a connection here. And so we want to think about, how do we optimize our sleep? Is there anything that you're doing right now that can actually result in improvements in sleep, whether that's following a more consistent schedule, making sure you're getting adequate amounts of sleep, making sure that the quality of sleep is optimal, that you're not having any disruptions in your breathing that's waking you up and not even allowing you to get into the right phases of sleep that may be the time when this housekeeping is occurring. So there's a lot about your sleep that can be changed and lead to better brain health and cognitive functioning, whether you're somebody who may be affected by a condition like FTD or Alzheimer's, or if you're cognitively healthy. These are all things that are important for everybody's brain health. What's the next ingredient? Mental stimulation. Well, this is how our brains enhance existing connections, make new connections, and build pathways in the brain. What do we mean by mental stimulation? It's learning new skills, remaining active mentally. That can come in the form of socializing with people. That can come in the form of learning an activity. If you wanted to learn how to juggle, there's a lot of motor coordination and practice and concentration and understanding how the physics and the biomechanics work. If you wanted to learn a new language, people talk about that a lot. Is that a way to make new connections and attune your ear in a particular way? Do you want to learn new dance steps? These are things that may be new to you, so we'll provide some form of stimulation. It may also be enjoyable. Whatever the activity is, it should be something that brings a little bit of novelty to your day, because our brains, especially the hippocampus, that part of the brain that's involved in forming new memories, the hippocampus responds to novelty. So the way we can actually exercise that part and that network is really by engaging it in trying to do new things. Now, when we talk about learning new skills, I often say that with a bit of caution, a word of caution, and that is you want to make sure that you're learning skills that are within reach. So if you're like me, who has very little background in physics or rocket science, I'm not going to try to learn how to be a space shuttle pilot. It has to be something that I think is still within reach for me, that is enjoyable, and that's something that will allow me to slowly improve and work towards this new goal while gaining new skills and new knowledge. Okay. Now, here's the biggest one, exercise, physical activity. This is an area which has shown the greatest promise in terms of brain health. You've seen lots of these articles. The research articles have been flying thick and fast over the past 10 years, and to the point where it's been picked up just as regularly in popular press. These are all articles that have come out over the last 5 to 10 years or so in the New York Times, Walking, stretching, or dancing? What's the best for the brain? Is dancing the kale of exercise? The most recent one, how exercise enhances aging brains. This last one here was just published, I think, last year. And essentially, in this study of healthy individuals, what they found was that they took individuals who were sedentary and started to get them moving through some sort of aerobic activity, and it didn't have to be a high level of aerobic activity. What they found was when they looked at their brains, those portions of the brain that are involved in memory that were previously not as well connected, the connectivity there started to strengthen and enhance to the point where it also led to improvements in memory. So we know that exercise is an excellent way to get your body healthy, but now we know that it's also potentially helping our brains get healthier. Not only is it actually making better connections and enhancing the connections, but potentially, depending on the type of exercise and the studies that we look at, can actually be promoting the production of certain growth factors in the brain that could help promote more brain cell production. So this is one area I think that we have the strongest research to support its benefits for brain health. And I think one that is fairly reachable for all of us, because physical activity in the end can be anything we want to define it as, and can be done at home, in your neighborhood, online. There are a lot of ways in which we can get creative here. And this is what I'd like for you all to think about. What type of physical activity can you bring into your lives that would increase your activity level, make you less sedentary, and engage you in a particular way that's good for your brains? This study turns out to be one of the most compelling studies, and to look at the impact of physical activity and cognitive activity and its impact on long-term outcomes in individuals with familial FTD. In 2019, our colleagues, part of the Artful Lefty studies, which many of your loved ones have been involved in. In this study, our colleagues looked at lifestyle, physical activity, cognitive activities in individuals who had some genetic alteration associated with FTD. And basically, bottom line here is that they found greater physical and cognitive activities were associated with more than 55% slower decline per year among those who had the genetic alteration. Those who had higher activity also seemed to show better cognitive performance over that time and less atrophy, it seemed, in brain tissue. So it seems as though the pattern is the more active your lifestyle, the more that's associated with less decline and better brain volume. Okay, so this is also incredibly encouraging because in the past, the concern had always been, well, what can physical activity do in a brain that may have a condition such as FTD or Alzheimer's? And now we're seeing more and more evidence that an active lifestyle can actually change that trajectory of decline over time, especially in those who may have been a little bit more sedentary to start with. There's never too late to try to incorporate some sort of physical activity into your daily life and routine. How do people do that? Right now, people are saying, I can't get to the gym. I can't go out running as easily because of the weather. Well, the internet has proven to, once again, be quite helpful in this situation. Many patients I've spoken with and worked with have found creative ways. Both the patients and their loved ones have been able to find classes online. Here's just one example of a chair yoga class that they were able to find. And you would think that it may not be the best way to actually engage in a class because there is that bit of a delay and there are technical glitches that can come up. But when it works, it's actually remarkably a helpful tool here where you can follow the teacher, and the really good teachers are able to give individual instruction and feedback to people even in this environment. So I personally have been able to find classes with teachers out of state, around the country, around the world even, and has increased my access and opportunities such that even when things lighten up in terms of the pandemic and we're able to get back out there and engage more again once it's safe to do that, I still now have even more resources to look to. So when you think about your physical activity and exercise regimen, what is it that you can think of that fits your life, whether it's something at home on Zoom, or is it something out in out there in your neighborhood? Many options to look for. So exercise means cardiovascular activities, dance activities are great, strength training. Think about these components when you're trying to come up with those ingredients for your exercise routine. Think about what's the right amount. Generally, that's something that you want to work out with your primary care doctor, because they know what you're able to tolerate, and they may be able to help you come up with what that right amount is. In addition to thinking about what some of the recommendations are right now in terms of hours a week and the intensity, generally your doctor will help you think through some moderate form of exercise that's safe for you to do, but that gives you a little bit more of what you're doing than what you're doing right now, okay? So when we think about some activities, giving examples and interventions, at this point, I just want to point out some of the activities and interventions that tap into all the ingredients I've already described that have shown some efficacy. So there's research there to suggest that some of these activities may lead to, that may promote better brain health. Mind-body activities, Tai Chi, which is a slow but choreographed series of movements that involve engaging your body and toggling back and forth between the sequence that you have to keep track of, so engaging your memory and your attention, as well as where your body is in space and in time. Some people liken it to some form of dance even, because it is choreographed in a particular way and involves remembering certain sequences and where your body is and body placement, okay? So there are studies now that have shown that Tai Chi can actually enhance that divided attention, or the ability to go back and forth between one or two ideas. Yoga does the same thing. And there's some studies also showing a similar effect of yoga on that mind-body connection and enhancing those connections in the brain and motor functions. Meditation. There's been a lot of interest in meditation, again, a mind-body activity, which helps us enhance the way we engage our attentional systems. Our colleague, Dr. Lazar, has shown some really strong evidence that meditation can enhance reasoning and problem-solving skills in individuals who engage in it. And these enhanced abilities seem to last over time. So they don't just improve while they're engaged in the study. They've been following individuals even after they've completed the study. And many of them continue to practice their meditation, but the changes in their brain seem to be maintained even over the course of several years. So something just to keep in mind, these mind-body activities can be quite helpful for enhancing that mind-body connection, and could be a really great way to start your physical activity and your brain health routine. Music is one topic that, as many of you know, is close to my heart, and is a way to provide the mental and physical stimulation that I've been describing. Music has a number of ways in which it can actually improve our brain health. There's a physical activity of dancing to music, right? So not only are you moving to the music, but you have to actually be able to pay attention to the music, pay attention to the rhythm. Are you in step? If you're singing and learning how to sing, are you singing in tune? Are you actually following the music? Learning to read music is like learning another language. So music has a lot of opportunities here. It can open a lot of different avenues by which you can actually engage with music and also engage in those brain health and brain exercise pieces. The other thing I love about music is that we can choose music that we enjoy. If we enjoy music, there's definitely support in the research to suggest that when we engage with music we like, it enhances our mood. It can actually lead to stress reduction. Music also brings back memories for many of us. For me, I rely on music and things that have rhythm to it, really, to help remember things. This is why commercials work so well on many of us. If you can remember a jingle, you can remember that particular product. But most importantly, I find that music can just bring so much joy to the activity that you're doing, that's one way in which you can actually stay engaged and also get that physical reward. When we enjoy something, we physically feel better. There are endorphins that are released when we're involved in those music-based activities. And that is another way in which we can then continue with the other brain-based activities we're trying to work on, if it's dancing and moving and singing or playing an instrument. Okay, so I encourage you to think about what music-based activities can you incorporate into your life. You'll see people on the internet dancing in their kitchens while they're cooking, or just to improve the mood and feel good. How can you bring music into your life? And finally, there's a lot that has looked at writing and journaling and use of language, really. Writing and journaling is an active and productive process. And when you actually have to put your thoughts to words, that's a form of mental activity, really. And so people have found that engaging with language in that way may not need to actually talk to somebody, but trying to think about what you did that day and trying to put those into words. It's a way of recollecting and pulling together information from the day. You're repeating it, you're enhancing that connection and those new memories that you're trying to lay down. So I always find that trying to produce anything that's productive is a form of brain exercise. And there's enough out there right now that suggests that writing and journaling and putting things down into the written word, in addition to talking about it, obviously, it can really be an excellent brain health and brain exercise or activity. So people often ask me about computer-based training. What's the verdict? There are a lot of programs out there where you can get a subscription and engage in a whole host of activities that aim to improve your processing speed, your attention, your short-term memory. And the research studies on computer-based training is really mixed, and the jury is still out, essentially. The question often is, if I improve in these games, does this mean that that cognitive area, that domain of thinking, will improve enough so that I can use that in other areas of my life? If my processing speed improves on this particular game, does this mean I'll be faster in other aspects of my activities? The results on that are really, truly mixed. And the other issue is whether or not these gains will last for a long time, even after you're done with the brain training. It's one way in which to stay stimulated. It may not be the best for you. I think something that allows for a much more social activity rather than just sitting individually at a computer screen. Probably with that social component, you get a little bit more stimulation. So computer-based training, it's unclear what can actually come of it. Again, the studies are really mixed in terms of its benefits. So just keep that in mind. Is this something that you can get the most bang for your buck, sitting in front of a computer and engaging in those exercises? I would think that you try to find activities that allow for you not only to get the mental stimulation, but also the physical stimulation, and most importantly, socialization. Okay, and this is something that I think really having the connections to people is so important for our brain health, for our mood, as well as for engaging our multiple cognitive abilities. When we socialize with people, we have to talk, we have to pull out information, we have to express emotion, we have to listen to other people and try to incorporate what they're saying to us. And socialization doesn't have to be just something verbal. Even being with other people, even if you're dancing with other people, if you're cooking with other people, if you're listening to other people as they talk about their lives and their days, having that level of stimulation and engagement not only enhances the cognitive capacities that we need for being engaged, but also enhances our mood. It also can be helpful for stress reduction. So I think social activities, ones that involve other people, can be really helpful for maintaining brain health. You might think that during the pandemic, it's really hard to do that. But again, the internet has allowed us to stay connected to our family and friends, and probably more so now that we're getting used to this way of interacting. It's allowed us to connect with people we may have forgotten about and haven't been in contact with in a while. So I find that the world has gotten very creative during the pandemic, playing tennis across rooftops, having groups singing in the streets to stay connected with one another. So I encourage you to think about what ways that fit your lives in terms of How do you stay connected socially with the people important to you, and making new friends even? And, that's a form of stimulation that I think we need to keep in mind. Finally, we need to make sure mood and stress are well managed. And simply because mood and stress, we've already talked about how stress stress is associated often with inflammatory responses. Mood can have a significant impact on how we engage with the world. There's also a chemical change that occurs in our brains if our mood is low, if we're stressed or we're depressed. So you always want to make sure that your mood and anxiety are well managed, because it can have an impact on your physical functioning, your metabolic functioning, medical conditions. It can really reduce your activity level, which can then again affect your physical and brain health. So something just to keep in mind, and I say this directly to our care partners out there, really important that mood and stress management is on your list of brain health targets, because care partners are under a particular type of stress. And if we can't help you manage that, you may not have the ability to carry on with the very important work that you are all doing for your loved ones. So mood and stress management is good for your brain, it's good for your health, it's good for you, and it's good for your loved ones. So something just to keep in mind. Find purpose and meaning in all that you do. You don't want to just do it for the heck of it. Okay, you want to do an activity because you're interested and you're engaged, whether that's about being with your family, whether it's about helping your community, whether it's because you're just interested in a particular topic and that's why you want to pursue it. You can't just do something because somebody tells you to do it. Patients will often say to me, should I be doing crossword puzzles to maintain my brain? And I ask them, are crossword puzzles things you enjoy doing? And they say, absolutely not. It's something that I really find boring and difficult and I really don't enjoy it. And so I say to them, why do it then? You want to do something that you enjoy, that you actually find meaningful in a particular way, that you get something out of and that gives you something in return and gives you that feeling of reward and enjoyment that allows you to stay engaged and continue with that activity. So everything that you do, think about how it's connected to other areas of your life. So now my question to you is, do you have the ingredients for maintaining your brain health at home? What's in your brain health pantry? And when we talk about it, we talk about thinking about what's available to you. You need to get creative in some ways. I know for a lot of patients, they said, I can't go to the gym anymore. What am I doing for strength training? Well, some of them have turned to taking those cans of soup and jarred items and using that as their weightlifting regimen, going up and down the stairs, learning how to do certain types of exercises against the wall. It's involved getting a little bit more creative during the pandemic, but if you sit down and think about it, and do this in a collaborative process, I think you'll find that there are many activities at home that you already can do and make part of your brain health regimen. Gardening, yard work, activities and games with family members, double duty with indoor activities. When I'm cleaning, it's a physical workout, but if I'm cleaning to music, it's a lot more enjoyable. Online activities, as we already talked about. I always encourage people to find some way to dance. People are able to now take tango lessons. Partners are able to take tango lessons online. So many resources online where you can actually engage with music in a particular way. Museums are offering video tours of their collections in intimate ways that you may not have been able to do previously. So what are the ingredients that are available to you? What's in your pantry? So now that we've thought about what ingredients might be in your pantry, my question to you is, what ingredients are you going to put into your mixing bowl? What is your recipe for brain health and building and maintaining cognitive resilience? So I'm going to leave you with that today, but I look forward to hearing from all of you to hear more about the ingredients you've chosen and would love for you to share your family recipes for maintaining brain health. So thanks for being with me here today.